Hello, my name is Crystal Santos, and this is my PDSA presentation on palliative care education. Introduction. The problem. The problem is that nurses lack palliative care education and advocacy. Nurses need to become stronger advocates for patients in order to provide a better quality of life to those who continue to suffer from chronic illnesses and for those who are at end of life. The United States is expected to experience rapid aging of the population over the next few decades. By the year 2050, the number of Americans over age 65 is expected to grow to 88.5 million. Quality variance. The main concern is that there are patients who do not receive palliative care measures because nurses are not always able to identify patients who are candidates for palliative care. Therefore, nurses need to be more proactive in advocating and addressing patients who actually do need palliative care. Change is needed in promoting and supporting the need for palliative care so that patients who are dying or are in pain achieve the best quality of life throughout their care. There are also not enough palliative care nurses and providers. The stakeholders. Who is involved? The patient, as well as the family member and caregivers, the healthcare team, which include the nurse, the hospice nurse, the primary care physician, and spiritual care team. Committees and regulatory agencies include the National Hospice and Palliative Care Organization, Regulatory Committee, the National Hospice Foundation, and the Joint Commission. Methods used to measure existing evidence of the problems are through benchmarking. As the cost of healthcare continues to rise and more Americans are living longer, there must be a way to measure existing evidence, and this is through a tool used for benchmarking, which is the ESAS, which is the Edmonton Symptom Assessment System. The Edmonton Symptom Assessment System. This is a tool that's used to improve nurses' knowledge of symptoms and management of patients needing palliative care. The plan is to provide more education to nurses, using a flow sheet to identify palliative care patients upon admission. Next would be providing classes to nurses and physicians about palliative care. In order to continue carrying out this plan, managers will have to be involved and meetings will have to be carried out to determine the effectiveness of the plan. Evaluating and determining the effectiveness would be by performing in-services regarding a flow sheet. A timeline would be created to assess the effectiveness throughout a period of 6 months. Constant repetition of the same information would provide habit to perform in their daily assessment. Empowering the nurses with knowledge will increase their awareness and make them stronger advocates for the patients. Giving them the right skills to communicate will improve patient outcomes and patient satisfaction scores. Analysis. Benchmarking programs such as HCAHPS surveys, palliative care services, and Press-Ganey satisfaction scores would be used to measure the effectiveness of the plan and improve efficiency. Regulatory agencies will also increase compliance and satisfaction. Incorporating the plan. There will be mandatory 8-hour classes held for 2 days led by a palliative care nurse. During the class, the nurse will learn about the new flow sheet that will be implemented and learn the importance of advocating to the families and the patients about palliative care, as well as the pulse. They will introduce topics such as advanced directives, end-of-life wishes, and develop skills to communicate effectively regarding difficult situations. The team leader will document problems and unexpected reactions from patients and will begin to add changes if needed. The nurse should be able to identify patients that would benefit from palliative care. They should be engaging in conversations with the patient and families about end-of-life care, if appropriate. The goal is that the nurse will feel more comfortable talking about death and comfort measures. The palliative care nurse leader will also lecture on the current updates on evidence-based practice and new methods of pain management treatment and the end-of-life comfort measures. After attending the class, there will be a mandatory assessment tool with case studies and modules to complete. The nurse must score above an 80% to pass and complete, or they must repeat the modules. The purpose of this assessment tool is to reinforce the material that was taught during the presentation. In addition, during each weekly staff meeting, all unit managers will reinforce the importance of completing the palliative care flow sheet upon admission. They will review patient satisfaction scores and how much progress of penetration has increased since implementing the plan. The other best way to reinforce the annual updates would be to incorporate the material through charting. The IT team will develop a new column or spreadsheet designed to identify if the patient is a candidate for palliative care, which will address identifiers such as chronic illnesses, chronic pain, and support systems. Lastly, the hospital will provide every unit with an in-service, which allows the nurses to interact and give their opinion about the new flow sheet incorporated upon admission. The effectiveness of the plan will be measured through Press-Ganey scores, penetration rates, and overall patient satisfaction, which will also increase revenue for the hospital. Efforts will be made to continue to reinforce the information to all the nurses. Palliative care leaders will round on the floors to speak to the nurse and obtain their feedback regarding the new flow sheet, any insecurities or issues that they have encountered with patients and families. The team leader will also review information regarding advanced care directives if needed. And this is the list of references. Thank you.